We have a GMA Health Alert for you about the risks and myths surrounding breast cancer. I'm here with board-certified breast cancer surgeon Dr. Kristi Funk, whose new book, it's brilliant. It's called Breast, the Owner's Manual, and it covers it all. Please welcome back Dr. Funk. I love this is so necessary because you bust a lot of myths and misconceptions. Because when I was diagnosed with breast cancer in 2007, I was alarmed when they said, you're always supposed to know your family history. And I said, well, I don't have any. They go, well, 80% of people who are diagnosed with cancer, breast cancer, don't have a family history of it.
Absolutely. So less than 10% of all breast cancer comes from an inherited genetic mutation. And as you note, a solid 80% don't have any relatives with breast cancer. There'll always be senseless cancers that happen in someone young or in someone who does everything right. But for the vast majority, a solid 80% of these cancers around the world, it does make sense, and it doesn't come from your family. It comes from the daily choices that women are making that have to do largely with nutrition and lifestyle behavior.
Well, so this is what I really appreciate about your book, among many things. You bust some of these myths and misconceptions. Tell people about some of them.
I love busting myths with science because you know what? There are enough things to worry about that do cause breast cancer. I'd like to take a load off and let you know what does not cause it. I've done all the research for you. It's all in the book. You can safely forget about your cell phone. It is the wrong kind of radiation, non-ionizing, along with your microwave, your television, and power lines.
Does not have anything to do with it?
Nothing to do with it.
Okay.
Deodorant and antiperspirants. I know, aluminum, parabens. I did all of the research. Doesn't matter. Birth control pills, tiny, tiny little bump in breast cancer, but once you go off your birth control, it doesn't matter. Fertility drugs don't matter at all for my infertile ladies out there. Caffeine, coffee, tea, chocolate, totally safe. Bras, with or without a wire, don't care.
Really? Because that was the one that a lot of people were thinking of as well. Well, what are some of the best practices to, I mean, there's no way to fully prevent, but what increases our chances that we will not?
So you can maximally reduce your risk by taking off these boulders that literally tip the scales way toward breast cancer. So here are your top 4. To get the boulders off, eat a whole food plant-based diet, tons of fruits and vegetables, legumes like lentils, beans, peas, nuts, whole grains. These foods act like phytonutrients, go into your bloodstream to seek and destroy cancer cells. Number 2, I want you to get to an ideal body weight and stay there for the rest of your life. Do not be overweight or obese. Number 3, exercise. You've got to bust a move like 5 hours a week.
Bust a move, I like that.
Unless you're super sweaty and can barely breathe, then you get 2.5 hours a week. And finally, limit alcohol, no more than 1 drink a day. So those are the biggies, but there are some little things. They're pebbles, they matter, they can tip the scales, but get the boulders off. So some pebbles, for example, are environmental toxicities that we all live with, like a barrage of chemicals in our home and work. But here are some tips on how to reduce your exposure to toxins.
Please.
Number 1, wash your hands frequently and always before you eat. You are touching things all day long and then eat them. So wash your hands. Number 2, dust and vacuum. Chemicals settle in dust, so just zip it up.
Wow.
Number 3, have houseplants. So NASA discovered that some really common, like hard to kill, so easy to maintain plants, spider plants, aloe vera, pull toxins from the air in your home. Next, exercise. You're just going to sweat it out separately from stool and urine. And finally, choose cleaner household and personal care cosmetic products, things that are chemical-free, or use essential oils instead of synthetic fragrances.
Yeah, those are all things that we can do. We have a question from the audience. Molly? Molly, do you have a question?
Yes.
What is that?
I am 39 years old, and we recently lost a family member and have lost many family members to breast cancer. Many of my cousins and other family members are getting tested. I have not been tested and not sure if I should or shouldn't, so wondering what you would recommend.
Well, Molly, I'm sorry for your recent loss. I would encourage you to test. The basic rule is if you have 2 family members with either breast cancer under the age of 50 or ovarian cancer at any age, consider testing. It's empowering to have the knowledge.
Oh, gosh. Well, thank you, Molly. And again, our heart goes out to you. And Dr. Funk, thank you very much. So give us, in a line, the bottom line from this book. What do you want for people to get out?
I want them to eat well, exercise, and to surround themselves with people who love and support and encourage them.
And she is that person, Dr. Kristi Funk. Thank you. Breast, the Owner's Manual is out tomorrow. Do yourself a favor and pick it up.